Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go get the free PDF at reallifepharmacology.com. It is a study guide on the top 200 medications. I lay out some of the most important things in clinical practice and in real life that you're going to see with those medications. 31-page PDF, absolutely no cost to you, simply an email is all it takes to get access to that. Then we also get you emails out when we've got new podcasts, new content available for you to benefit from. All right, with that said, let's get into the drug of the day today. That is Itraconazole. Brand name of this medication is Sporanox. Classification is generalized as an antifungal medication. More specifically, it's what's called an azole antifungal, which you can probably deduce from the last 5 letters of the name of the drug, itraconazole. So mechanistically, how do these azole antifungals work? They actually interfere with fungal cytochrome P450 activity, which decreases ergosterol synthesis. And if you remember, ergosterol is an important sterol in fungal cell membrane formation. So essentially, it inhibits fungal cell membrane formation, and that's how it ultimately helps treat an infection and kill the fungal infection. Now, what types of fungal infections is this typically used for? It can be used for a variety of infections. The risk, and I'll talk about that more coming up here, but we've got some boxed warnings for this medication. And so you really want to make sure that it's a serious infection, or it's an infection that, we don't really have other good options to treat. So with that in mind, some of the ones that you may see this used for, Aspergillosis, Blastomyces, Histoplasmosis. It can be used for something like candidiasis. Typically, in that type of situation, it's only going to be reserved for refractory cases where other medications are intolerable or they're not working. And again, this is primarily due to those boxed warnings as well as drug interactions as well. So itraconazole is definitely infamous for both of those. All right, so let's get into some of those boxed warnings and some of the risks associated with this medication. So first off, in talking about adverse effects, I got to mention the boxed warning in regards to heart failure. So it should not be given, specifically what the boxed warning says, should not be given for the treatment of onychomycosis in patients with evidence of cardiovascular concerns such as ventricular dysfunction or congestive heart failure. Okay. Now, the other boxed warning is co-administration with a number of CYP3A4 substrates are contraindicated with itraconazole. So, and obviously I'm going to get to the drug interactions, and I'm going to go through some of the highlights that I'm going to pull out. But there is a ton of drug interactions, and probably unless you work with itraconazole on a regular basis, I would be running a drug interaction screen on that patient's medication list. That's what I would do in practice. I don't see itraconazole used a ton. I see it occasionally, but whenever I see it, I definitely run that patient's medication list through the drug interactions checker. And making sure we aren't harming the patient. So that's kind of a lead into kind of adverse drug reactions, and those are the two big boxed warnings you should definitely know, definitely could come up on board exams and things like that. Other adverse effects, probably the most common, I guess, is GI upset. We've got oral capsule and we've got an oral solution as far as dosage forms go. And that GI upset's probably going to be the most common thing there. Some other things that can happen with all the azoles, there is some association certainly with hepatotoxicity. Other things to think about, QT prolongation. So I'll allude to that in drug interactions there as well. So again, cardiovascular-wise, if you know you've got a patient that's had some heart problems, some heart trouble over the years, definitely a good one to look at and say, hey, is there another medication other than itraconazole that we can use, or we got to monitor them really closely if we're going to use it. The hepatotoxicity I mentioned, low potassium, that is associated with itraconazole. Not something I typically crazy worry about, but maybe you've got a patient that's at risk for hypokalemia, so something to look out for, where that could have a little additive effect. Other kind of rare things, hypersensitivity reactions, and neuropathy has actually been reported with this medication as well. It is considered a high alert medication from ISMP. ISMP, that's the Institute for Safe Medication Practices. So that is something to be aware of, and that goes back to some of the risks that we talked about with the boxed warnings and drug interactions in those cases. There's also some evidence of potential harm in pregnancy. So generally, this is absolutely not going to be used in pregnancy. So that's something to pay attention to there as well. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material, like BCPS, ambulatory care, NAPLEX, geriatrics, or the BCM TMS exam, go check out meded101.com/store. We've helped thousands of pharmacists pass their board exam, and we can absolutely help you too. The study guides, study materials, they are tailored to the content outline of each exam. I go through them every year, try to review, update, make sure things are up to date with guidelines and new medications coming out that are relevant for the exam. So again, go support the sponsor, meded101.com/store, and I appreciate that. All right, wrapping up with drug interactions. So first and foremost, it is a CYP3A4 inhibitor. So itraconazole is a CYP3A4 inhibitor. Many medications can interact and have their concentrations essentially raised by CYP3A4 inhibitors, and particularly itraconazole is a stronger one. So medications like some of the statins, like simvastatin and lovastatin, lurasidone, triazolam, midazolam, some of the benzodiazepines, methadone, and opioid medication. There are some antiarrhythmics that can cause some trouble there and have their concentrations raised. Ticagrelor, cardiovascular medication there, that can have its concentrations go up. So again, tons of drug interactions. Again, I strongly encourage you, if you don't use this medication all the time or you don't see it a lot, you definitely got to run the drug interaction screen whenever you see a new prescription for this, or if you're thinking about writing a prescription for it. There is a food interaction potential here with the Sporanox 100 milligram capsules. Absorption can be enhanced by food and possibly gastric acidity. So something to be aware of. If you got a patient that's, maybe showing signs of toxicity or, not responding, you may do things differently there with how we're giving that medication to try to improve absorption there. And specifically on the drug interaction front, those taking things like H2 blockers can suppress, obviously, gastric acid, and that may affect absorption, may reduce absorption of those 100 milligram capsules. Other things to think about, so additive hypokalemic effects. So if you got patients on diuretics like loops and thiazides that lower potassium, this medication could worsen that. So pay attention to that. And then, of course, the liver risk. If we've got a patient that has a history of alcoholism and they continue to chronically use, they may be at risk for pre-existing liver impairment. And then, taking a medication like itraconazole, maybe we add further to that insult. Other medications, Depakote, methotrexate, high dose acetaminophen, or maybe inappropriately dosed acetaminophen. These are all other medications that can potentially have some liver impacting effects there. And then last but not least, got to mention QT prolongation risk, amiodarone, other antiarrhythmics, antipsychotics, citalopram, macrolide antibiotics, quinolone antibiotics. These are all meds that can increase risk for QT prolongation along with itraconazole, and that's something that we need to monitor and assess for there as well. All right, well, that's going to wrap up the podcast for today. Hopefully you picked up a few practice pearls. Do me a huge favor, leave a rating review on iTunes or Spotify or whatever platform you're listening on. I greatly appreciate that. Share the podcast, friends, colleagues, students, anyone who could benefit from some pharmacology education. And of course, check out meded101.com/store. We got tons of resources for all different sorts of healthcare professionals. So go check that out. Your purchases there go directly to support this podcast. If you want to reach out to me, comments, suggestions, mededucation101@gmail.com. You can also track me down on LinkedIn, Eric Christensen, PharmD, BCPS, BCGP. Thanks so much for listening. Take care. Have a great rest of your day.